The switch to virtual learning comes as cases accelerate statewide. Hospitals are seeing similar rates to what they saw just in January.
And that was before a vaccine was widely available. Now, while the numbers are alarming, it's not all bad news. Tom Durian filed this report earlier in the evening.
With the current number of patients we have in our hospitals, we're noticing a pretty significant crunch.
Dr. Brad Burmester is an ER doc at Bellin Health in Green Bay, and he's also part of the Wisconsin COVID-19 task force. He, like other healthcare professionals, is watching the number of COVID-19 patients in the hospital rise.
You're just about to start your shift in the ED today. Is it 100% likely that you're going to see a COVID patient?
Oh, yeah. Absolutely. I had gone a couple of weeks back, and I think it was June, without seeing any patients with COVID into July. And now it's multiple patients you see with COVID per day.
It wasn't that long ago. We had about 74 people in the hospital with COVID. Now we're over 1,000.
The numbers from the Wisconsin Hospital Association back up what the doctor is seeing. On November 17, 2020, we hit our peak with 2,277 patients in the hospital with COVID. As of today, we are at about 50% of that with 1,039. But look at the ICU numbers representing the sickest of patients. They are inching closer to the highest number with only about half the number of patients in the hospital. The trends are concerning.
Hospitalizations are again rising at a precipitous rate. There does not seem to be a slowdown in sight.
Wisconsin Hospital Association CEO Eric Borgerding says the state's total number of patients is gaining an average of 15 to 50 a day, but he doesn't believe we are at a place where another alternate care facility is needed.
Vast majority of hospitalized patients are unvaccinated, just like they were back in the fall, because the vaccine didn't exist. Right now, the best way to mitigate demand is through vaccine.
The surge in patients also having an effect on healthcare workers. Already facing a shortage, many who are working are facing long hours and burnout.
It's a challenging environment right now. When they're at work, it's just a continuous busy shift. There's not much time to just take a deep breath and take a moment to yourself.
Tom Durian, TMJ4 News.